Are you interested in making a career move to medical coding, but you want to know more about what is medical coding? What is a day like for a medical coder? What's the salary? What's the job outlook? I'm Victoria Mole, and I've been in this industry for over a decade. I've spoken at local, regional, and national events and have educated thousands of medical coders over my years. I've been published in magazines, I've been interviewed in podcasts, and I have dominated medical coding on YouTube. In this video, I'm going to tell you all about medical coding, including the work from home potential, and even give you my best tips on how to get started. Hey there, I'm Victoria Mole. I'm a medical coder, auditor, educator, and on my channel I provide tips, tricks, and tutorials to help you be successful in a medical coding career. If you're just looking into medical coding, I'm going to tell you all about what medical coding is like and guide you on the career path to becoming a medical coder. First off, medical coding is not like other types of coding. It's not a programming language like JavaScript or COBOL. Medical coding is the translation of medical diagnoses, procedures, equipment, services into designated code sets. Now, it's not quite as easy as looking something up like you would in a phone book to find a phone number. There's a lot of different rules and guidelines and regulations that go into medical coding. It also requires a significant amount of reading of medical records to translate them into the correct codes. So this is definitely a career for people who like to do a lot of reading. If you're someone who enjoys maybe medical dramas, there is that kind of component of it because you almost get to read it in like textual format and then translate it into codes. And some of the places where you work as a medical coder, so you could work at hospital, physicians' offices, billing offices, insurance companies, and if you specialize in certain areas like the emergency department, you get to see just about everything. So it can be very interesting things that you're reading through into these different medical records. So you may have seen some of these codes if you've ever gotten a medical bill and looked over it. They'll give you maybe a line description of what type of service you received, and oftentimes there's a 5-digit CPT code on there. CPT is one of the code sets we use as medical coders. It is current procedural terminology. CPT codes are each 5 characters long. Sometimes they just represent a small piece of text procedure. Other times it has to be quite lengthy pieces of text or records that have to be translated into that 5-character code. And then there's certain procedures that may be included in a bigger procedure, like if you have a appendectomy, there might be a code for an incision, but that would be included in the appendectomy. So you have to know those sort of guidelines when you're coding. And then there's diagnosis coding. So we have ICD-10-CM. So ICD-10 is used globally, but there's different modifications that they use depending on your country. So in America, the United States of America, we have the ICD-10-CM, which is the clinical modification, and that's used in the United States. The codes for that are between 3 digits and 7 digits long, and there's actually a decimal point after the 3rd character if it goes past the 3rd character. There's actually over 100 pages of guidelines on just diagnosis coding alone. Some of the guidelines are things like if you have a more severe or specified diagnosis, you don't include like symptoms of that diagnosis. So if you have the flu, you wouldn't include that they also have a fever because that's inherent to having the flu. There's also sequencing guidelines, so certain things like an acute condition has to become before a chronic condition. And then we have what we call the HCPCS code set, which is also 5 characters long, and that is codes for different types of durable medical equipment, drugs, supplies, or even insurance-specific type of services. So for example, there is a generalized code for administration of a flu shot, but then there's a Medicare code that Medicare specifically wants for their patients for administration of a flu shot. Medical coders work a lot with these different books. Now, depending on what type of coding you're doing, you may work with all 3 of them, or you might work with just one. The most popular type of coding is what we call professional coding, and that's coding for provider-based services, and they use all 3 code sets. Now, there are certain types of programs and software you can use to help guide you to look up codes or give you information, but in order to become a certified coder, you need to sit for a certification exam and use paper books. And really understanding what's in these books, how to look things up, and the sequencing guidelines and the different information about how to utilize these codes is what's going to make you knowledgeable and successful as a medical coder. It's not quite as easy as a one-to-one match, like this equals this code. Oftentimes there's one word that could change and might change the code set completely differently. You may even have to send a query back to the provider because there's something that you need it to be in the medical record to code it and just isn't there. So there's a lot of different factors that go into the right code selection. If it was just as easy as, this is X and it translates into Y code, it probably wouldn't be a job that would be reimbursed very well because it could be very easily automated. Now, on that topic of automation, there has been some concerns I've seen raised lately, especially from people looking into getting into the industry, that medical coding may eventually be completely automated, kind of in the way that transcription, for the most part, became automated. So while there will be a lot more efficiencies that happen in medical coding over the year, it will not be a position that is completely eliminated. It may transition more in the long term to a quality review or auditing sort of role, but there will never be a program that can completely replace a medical coder. Actually, over the past few years, a lot of stuff has been developed that is computer-assisted coding, and sometimes they're very good at what they select. Other times it is completely off, but either way, you need to have a coder in there to review what's being assigned. And really, the codes that are being spit out are only as good as the quality of the medical record that's being compiled by the physician. And sometimes in the rush, the provider will just pick diagnoses because they want to get through their case, and they're really not done correctly. And the computer process that match that just says, oh yeah, diabetes is this code, and spits it out, doesn't understand maybe that somewhere in the documentation there was a more specific code that could have been utilized. So there's a lot of inefficiencies, and medical coding will never be completely eliminated. However, there's going to be a need for a lot of coders that are able to think more critically, to see things that maybe should have been in the documentation and weren't there, or work with the providers on improving some of their documentation. And that's why coders that have a stronger understanding of healthcare processes and the coding guidelines are going to have a better career outlook. So I mentioned about healthcare processes. So medical coding is part of the healthcare industry, which does mean that as part of that, you do need to understand things like medical terminology and anatomy and physiology. There are some organizations out there that will tell you, oh, you don't need to really know medical terminology, and I can tell you those organizations aren't really very well respected in the industry. In order to be a successful member of the medical coding field and the teams that you're going to work with, as far as even if you're working in insurance or with physicians or with a billing office, you're going to need to be able to speak the jargon, to understand the jargon. Now, this doesn't mean that you have to be able to catheterize a patient or draw their blood, but you do need to understand the medical jargon and the clinical process. Medical coding is also a productivity-based position, so you have to code a certain amount of charts or procedures or diagnoses within an hour, which means that if you're constantly looking up different terms and procedures and Googling things, that's going to slow down your productivity. Now, presumably after a while, if there's certain ones that you don't understand, you'll pick up more speed, but you have to understand that there is oftentimes very strict productivity rates with medical coding, as well as accuracy rates. So you need to understand the medical terminology as well as the coding guidelines very well, not everything memorized, but very well, so that you can have good productivity and you don't wind up in some sort of performance improvement situation with your manager. Now, while you can pass most coding certification exams at a 70%, most employers require an accuracy rate of 95% for their coders. So with these productivity expectations and these accuracy expectations, it means that you need to devote some full attention to what you're looking at so that you can be successful and meet those goals. This can be very difficult to do if you're working from home and you have a lot of distractions like young children running around. A lot of employers do have strict guidelines that they say if you have younger children that are not self-sufficient, that they do have to be otherwise supervised either by a babysitter or in school or taken care of by someone other than yourself, because you need to devote your time to paying attention and being successful at your work. Now, as of the time I'm recording it, we're kind of in the middle of the COVID pandemic, so there's been some flexibility about this, and there may be a little bit more flexibility continued, but I don't foresee it to be long term. Especially since most medical coding positions are hourly, meaning they're paying you by the hour to get your work done. They don't usually give the flexibility of, oh yeah, just get X amount of charts done, and however you get them done during the week, it doesn't really matter. Now, there are some jobs that are paid per chart, but again, in order to get a lot of charts coded and get more money, you need to have that dedication and time so that you can concentrate and get those coded. And a lot of organizations do want their coders to work fairly standard hours. They might say, hey, the earliest you can start is 6 a.m., the latest you can work is till 6 p.m. Others, they might be a little bit more flexible, but generally speaking, they are day shift hours. So I wouldn't rely on the fact that you're going to be able to find a position that is extremely flexible with you, at least initially when you're starting to look for work just after getting certified as a coder. Medical coding jobs can be hard to come by, especially when you are very new to the field. And one of the things that these schools leave out when they tell you, oh, there's this huge demand for medical coders, is the majority of the demand is for coders that have more than 2 years of experience. And there is a conundrum, because how do you get the experience if no one will give you a job? And some organizations require their coders to meet accuracy and productivity expectations before allowing them to work from home. Medical coding is a great job. You often get very good benefits if you work for healthcare organizations. There's lots of different growth opportunities, different types of specialty certifications you can get, but it really is something that you have to enjoy. You have to enjoy reading through those medical records and piecing the puzzle together and coming out with the correct code. If you're just looking into it just because you heard it was a quick and easy work from home job, not so much. There's actually a huge commitment to continuing education for medical coders. Just like doctors and nurses, medical coders also have to get continuing education units. Depending on where you're certified, it could be a certain different amount per year or per every other year, but that's to prove that you are current in your knowledge of your field. So to be successful as a medical coder, you have to have that commitment to continued learning. Things change. Every year, these different code sets have hundreds of changes. So every year you need to get new books or new software updates because there's hundreds of changes you need to learn. There's different specialties to learn. I mean, if you think about just the medical field as itself, I mean, there's how many different specialties. Now, coders oftentimes will concentrate in one or two or a handful of specialties, but in order to pass the certification exam, you need to know a little bit about all of the different specialties. Staying on top of all those updates and guidelines is really crucial for a medical coder. Now, a lot of employers will help you with some of that. They might help you find continuing education units or pay for your membership fees, but some of them don't have a large budget, so you may be responsible for finding your own continuing education units or paying for your own membership fees. If you're interested in the costs associated with becoming a medical coder, I do actually have a video specifically on that. You can check that if you hit that I button above. That will take you to that video. I'll also link the video in the description below. Now, most employers will only hire coders that have passed a certification exam, and the two most popular organizations are AAPC and AHIMA. There are other organizations and nothing against them. It's just that the AAPC and AHIMA are the ones that employers are looking for. So if you're enrolled in a school or looking for a school, they may, as part of that, offer you a different type of coding certification, like the CBCS is one they often include. Nothing against that, but understand that in order to be marketable, you need to get a certification through either AAPC or AHIMA. If you're not sure which way to go, I always say default to the AAPC and get their CPC certification, because that is the most widely desired certification. So the AAPC primarily focuses on professional coding, so coding for services that are rendered by physicians and advanced practitioners like physician's assistants. And then AHIMA usually concentrates more on what we call inpatient or facility coding. So that's a lot of times taking all the different conditions that the patient has while they're in the hospital, grouping them together in a diagnosis-related group, and that's a reimbursement that goes to that facility, to that hospital, for all that patient's room and board and labs and all kinds of different services that they had while they were in the hospital. So again, if you're not sure which way to go with the CPC certification through the AAPC, because it's more widely desired. Also, there's no prerequisites or requirements in order to sit for that exam. You don't have to have taken a certain class. Technically, anyone can sit through it, but for AHIMA, there are requirements, very specific ones, that you may have to go to an accredited school for some of their certifications. I don't know the exact details of what they require for each one, so check out the AHIMA website. Now let's talk a little bit about schooling. So if you're already working in healthcare and you know midterm and anatomy and a little bit of clinical process, and you know health insurance and EMRs, it might not take as long for you to learn medical coding as someone who's coming in with zero experience. I'm actually someone who came in with zero experience. So someone who already has some experience could probably take a shorter path, maybe a boot camp or concentrated course, and pass a certification exam and be more successful. But if you're coming in with zero experience, I would really recommend getting at least a diploma program. Now, depending on how accelerated it is, it could be anywhere from 3, 6, 9 months to a year, and also depending on how much time you have to dedicate and your funding and so forth. Check with some of your local community colleges, business schools, technical schools, because they often have programs, and then they are able to provide you with appropriate student financing. Going through an official college or university or school is really the only way you can receive financial aid. Now, there's lots of other courses you can take online to learn medical coding, but since those are privately owned instructors or institutions, you can't always get financial aid, but they may offer you some sort of payment programs, or because they're smaller, they may just offer a lower cost. Now, I get a lot of questions about different schools, and I can't be familiar with every single community college out there. So what I've done is I partnered with onlinedegree.com, and they have taken the questions that I usually ask my viewers in regards to school, formulated them into a quiz, and it's going to ask you things like, where are you located? How much money are you looking to spend? How much time do you have to devote? How soon are you looking on graduating? And they can match you up with some really great options for medical coding schools. And they only work with legitimate universities, so you don't have to worry about getting scammed by some fly-by-night medical coding school that looks really great on paper or has cute little Instagram posts, but actually isn't going to give you a proper education, or they're just going to train you to pass a certification exam and then leave you high and dry. So you can rest easy knowing that you're getting into a good school, and the best part is you can get up to 10% off by using my link, and there's other perks that they may have available for my viewers. Now let's talk about salary. So this can range pretty wildly depending on where you're located, if you're in a suburban area or a very expensive city, or if you are doing certain job responsibilities, what type of coding you're doing, even if you have certain other experience that maybe isn't coding related, but maybe you've worked in the healthcare industry in the past, or you've done management positions in the past, so that can range a lot. But generally speaking, based off of the AAPC's most recent salary survey, the average salary of everyone who responded to their salary survey was about $55,000. Now again, that's an average, so everyone who has 0 years of experience, 15 years of experience, they work in all kinds of different specialties, that's the average. And I will tell you though, medical coding can be super lucrative, especially the more years of experience you get. There's certain specialties you can work in, certain types of coding. Sometimes if you even want to take contract positions, there's a lot of money to be made. And there are some coders out there, depending on what they're coding and their years of experience, can exceed 6-figure salaries. And those are coders that are often doing things like inpatient DRG validation or audits or consulting, but there's lots of ways that medical coding can be very lucrative as you progress in your career. Now, just starting off, the salary survey also revealed that people with 0 to 1 year experience are making quite a bit less, usually starting at about $40,000 a year. But again, there's a lot more growth potential in this industry. I will link the survey in the description below so you can see even more about how your salary may be impacted based off of things like your geographic location. In most jobs, you're going to have some sort of report or work queue or task list of assigned patients, and you're going to have to look through those patients for certain dates of services, find all the notes, and then read them and assign the appropriate codes. Those codes then go out to the insurance. Now, depending on if they hit a certain edit or if there's something going on with a denial, you may have to re-review some of those things that you've coded already. Depending on where you're working and what you're doing, you may also have to field questions from doctors, nurses, staff, managers, your boss, other people in the revenue cycle. If you want more information on what a medical coder does, check out my video, A Day in the Life of a Medical Coder. So that's it. If you want to work in the healthcare field but not have to deal with patients and clinical processes, and you still want to make good money, and if you like reading medical reports and puzzling them together and figuring out all the guidelines and translating them into codes, and you have that dedication to continuing education, you love to learn, this is probably a great career for you. It's not a quick and easy skill to learn. It does require a lot of commitment to studying and staying up with continuing education, getting that certification. And sometimes you might have to not even start out as a medical coder. You have to get your foot in the door and maybe start out in registration or working insurance denials or doing billing. But if this is really something you're interested in and you have that dedication, it is going to pay off so much, especially because of all the growth opportunities. And so many organizations are great to work with. You get really good health insurance and benefits. So if you have a strong and dedicated mindset, you can really go far in this career. If you're looking on making that move into a medical coding degree program, definitely check out onlinedegree.com and they can help hook you up with a fantastic program to learn medical coding. I hope you found this video helpful. If you did, I'd really appreciate it if you give it a big thumbs up. Don't forget to subscribe, and I'd love it if you hit that notification bell so that you can get alerts when I post new episodes. I will see you in the next episode, and until then, just keep on coding on.